Tetralogy of Fallot. Tetralogy of Fallot. This is the most common early cyanotic congenital heart disease, and the onset of cyanosis usually occurs after 3 months of age. And this is a right to left shunting of what? Of blood. And then what's the major problem here? This is due to abnormal neural crest cell migration, and this leads to misalignment of the aortic pulmonary septum, leading to anterior superior displacement of the septum. And there are 4 defects that we see as a result of this misalignment. So if we look at this diagram, we can see that the aortic pulmonary septum, right, has been moved anteriorly, and it also has been displaced what? Superiorly. So because of that, there is stenosis of the pulmonary infundibulum. So you can see that there is stenosis of the pulmonary trunk, and then also the aorta now is very wide, is more wider, and it looks as if it's receiving blood from both the right ventricle and the left ventricle. And then because of the superior displacement of the aortic pulmonary septum, there's also going to be a problem. This is going to pose a problem in the formation of the membranous part of the interventricular septum, so thereby leading to another defect, which is ventricular septal defect. And then because of the pulmonary stenosis, the pulmonary infundibulum stenosis, the pressure in the pulmonary artery is going to be increased, right? And because of that, so that means the right ventricle needs to increase its pressure so that it can push the blood through the pulmonary what? Through the pulmonary artery. And because of that, now that's going to lead to growth alteration in the right ventricle, and that's going to lead to right ventricular what? Hypertrophy. And as the pressure in the right ventricle is increasing, once you get to a point whereby the pressure on the right side is more than the pressure on the left side, then the blood, the deoxygenated blood, is going to be shunting to the what? To the left side. And as deoxygenated blood is moving from the right ventricle to the left ventricle, and then go to through the aorta, and this is going to produce cyanosis in this patient. So what are the 4 things that we want to see from this defect? So number 1, we want to have a pulmonary infundibulum stenosis. Number 2, we can see here we have the overriding of the aorta. Number 3, we have the ventricular septal defect, and lastly, we have the right ventricular what? Hypertrophy. So looking at the next slide, 4 defects in this patient. 1, pulmonary infundibulum stenosis, and this determines the severity of Tetralogy of Fallot. Very important. So what determines the severity of Tetralogy of Fallot is how stenosed the pulmonary infundibulum is. So the more stenosis you have, the more severe the condition is to be. And number 2, we have the overriding of the aorta, meaning that the aorta is receiving blood from both the right and the left ventricle. We also have the ventricular septal defect. So the membranous intraventricular septal defect because of superior displacement of the aortic pulmonary septum. And then remember, aortic pulmonary septum involves in the formation of the membranous part of the intraventricular septum. And then lastly, right ventricular hypertrophy. And then this is due to the pulmonary what? Stenosis. What are the clinical findings that we can see in patients with Tetralogy of Fallot? Number 1, harsh systolic crescendo decrescendo murmur, and then this is due to the pulmonary what? Stenosis. And then number 2, they want to have decrease in oxygen saturation in the left ventricle and also the aorta. Because if you look at the diagram, you can see that there's shunting of deoxygenated blood from the right ventricle into the left ventricle, so thereby decreasing the oxygen saturation in the left ventricle, and also that's going to lead to decrease in oxygen saturation in the aorta. This patient, they can also have what we call the teeth spell or hypoxic spell. This is due to sudden increase in hypoxemia and cyanosis due to events that exacerbate right outflow obstruction, an event like crying, fever, exercise. So any of these events can further worsen the pulmonary stenosis, right? So thereby making the what's called increasing the pressure in the pulmonary artery, and that's also going to further increase the pressure in the right ventricle, thereby leading to more blood, more deoxygenated blood being shunted to the left ventricle, and the more deoxygenated blood will be leaving through the aorta, and thereby worsening their cyanosis. And in this patient, they actually learn to squat right? And then how is squatting going to help them? By doing squatting, that actually increase the systemic vascular resistance. So squatting increase the systemic vascular resistance, or you can call it total peripheral resistance. And then what's this resistance going to do? So by increasing the systemic vascular resistance, right, in the artery, that is going to increase the pressure in the aorta, right? And as we increase the pressure in the aorta, the left ventricle needs to increase its pressure so that it can push the blood through the aorta. So that also going to lead to increase in the pressure in the left ventricle, thereby decreasing the right to left shunting of what? Of blood, right? So that more blood can go into the pulmonary system for oxygenation, and more oxygenated blood can return to the left side of the heart and can live through what? Through the aorta, right? So that's what we call that's how squatting actually helps those people. So by increasing the systemic vascular resistance, which leads to increase in afterload, and a decrease the right to left shunting of blood. And this leads to increased pulmonary blood flow for oxygenation in the lungs and improves their cyanosis. So how do we make the diagnosis? So on the chest X-ray, you want to see what they call the bull-shaped heart, and the bull-shaped heart is due to the right ventricular hypertrophy. And also when you look at the chest X-ray, this patient they want to have decreased pulmonary marking because of decreased pulmonary blood flow. And also you can also do echocardiogram in this patient. You can also do cardiac catheterization in this patient. And the treatment, definitely you need to maintain the shunt. You want to keep the ductus arteriosus open, so you need to give them prostaglandin. Also oxygen can also be beneficial in this patient. Need to chest positioning during cyanotic episode, right? Remember, by positioning, so you are trying to also then relieve the sinuses, and a surgical correction.